Thanks for staying with us tonight for 13 Action News live at 6:30. Well, the pandemic has tested our community here in Southern Nevada in ways very few people have ever experienced. Mask wearing and social distancing have now become everyday routines.
But tonight, right now, questions about our future. So is COVID here to stay? And also, what can be done now to prepare for the next pandemic? And 13 Action News reporter Jeremy Chen is live for us tonight at Southern Hills Hospital, digging for the answers to those questions and more. Jeremy.
Yeah, Todd and Tricia, certainly according to local health officials, there is some light at the end of the tunnel, especially with the fact that we are getting shots into people's arms with the COVID-19 vaccine. However, they do say there is the possibility that COVID-19 could linger into the future. However, we will be ready.
The COVID-19 pandemic has been the focus of the Southern Nevada Health District for the past year, working with local and state officials on guidelines in curbing the spread of the virus.
We have a very strong community, and we have a lot of local resources, and also
Dr. Furman Leguen, Chief Health Officer for the Southern Nevada Health District, says COVID-19 remains a new virus that continues to be studied. There is some suspicion in the scientific community we may be dealing with COVID-19 for a while.
It might be present, for years in our communities. Of course, not at the degree that we are seeing now, but perhaps more kind of similar to what happened with the flu.
As more is known about the virus, the efforts to vaccinate Nevadans will continue.
Without it, we don't go back to normal. If we can get enough of our population vaccinated, we can start to reopen our city and reopen the country and go back to the events we had before COVID.
Dr. Brian Labus with UNLV says this would mean getting herd immunity from the virus, which would be about 70% or more of Americans getting the shot.
It's a bit of a challenge to reach, considering that kids make up 22% of the U.S. population and they're not eligible to be vaccinated yet.
Dr. Leguen says he believes there should be a focus on adequately funding public health in order to have programs in place to respond to future disease outbreaks. He says local health districts across the country, including SNHD, have been historically underfunded and understaffed. During the pandemic, SNHD received a surge in funding from the state and federal governments to respond to the pandemic.
What will happen after the pandemic? Because that's what the question is. Now, you really need funding to keep your staff ready to respond to anything.
And doctors are continuing to ask people to keep on wearing your masks and social distance while in public, including if you've been fully vaccinated. Now, coming up tomorrow, continuing our Lights Out series of stories, we will be focusing on how COVID-19 has affected education here in Clark County in the past, present, and future. Jeremy Chen, 13 Action News.
All right, Jeremy, thank you for that. In the meantime, COVID-19 is also changing surgery. The American Society of Anesthesiologists, or ASA, says that it is likely that you will be required to have a negative test before surgery for the foreseeable future. There's also no evidence that COVID or the vaccines interfere with anesthesia. It does recommend waiting 4 to 12 weeks to have surgery if you recently recovered from COVID-19, and that you should also talk to your surgeon or doctor about if you should wait to get vaccinated before getting surgery.
The medical system in Nevada came close to fracturing at the beginning of this pandemic, and officials raced to increase hospital capacity and avoid having to ration care. Researchers also jumped into action, helping keep hospitalizations down. One huge advancement was the development and use of multi-COVID antibody cocktails. Monoclonal therapies like Regeneron or IV infusions, helping infected patients' immune systems ramp up. Nurses and doctors remember charging into the pandemic nearly blind.
We're cautious and nervous, but we knew we had a job to do.
That was at a time when we didn't really have any known treatments available.
And the most monumental achievement to date is the development of multiple highly effective vaccines from Pfizer and Moderna to Johnson & Johnson. And our Lights Out coverage will continue all week. We have more stories tomorrow about the past, present, and future regarding COVID-19 here in Las Vegas.
New tonight at 6:30, CCSD holding a forum discussion on mental health tonight. Now, it was called Together We Triumph. The goal here was suicide prevention. Now, the online forum started at 4 o'clock, just wrapped up just at the top of the hour. Well, Hope Means Nevada was one of the groups that took part.
And the goal is to start having the conversation earlier, because our goal is not a solutions provider. We're not there to answer the calls on the suicide line, but we are there. And I just became more involved as they became more involved, because I saw how passionate they were about it, is to really shine a light on the struggles of youth and teen mental health issues.
And Angela Edgeworth also says that many boys and also men don't want to have that conversation, so they want to end that stigma of opening up. Unfortunately, 20 students now have taken their own lives since remote learning began last March. And so if you or someone you know is struggling with suicidal thoughts, you could call the National Suicide Prevention Lifeline. The number, there you see it, it's on your screen right now. It is 1-800-273-TALK. Again, 1-800-273-TALK.
Well, Southern Hills Hospital holding a moment of silence this afternoon to honor those impacted by COVID-19. The hospital held the moment of silence outside the hospital just after 3 p.m. And doctors and nurses say they will always remember this past year and the struggles that the pandemic brought.
We won't forget this year, and we will always remember what we went through, what people went through, what families went through. At a time where visitors weren't allowed in the hospital, the nurses stepped up and became the family members for those patients. Those are bonds that will never be forgotten, never be broken.
And we thank them for their service. And Dr. Ahmad says that doctors, nurses, and hospital staff became an extension to the families of patients.
Yeah, they all really did such noble work. All right, we'll come up here on 13 Action News live at 6:30. The issues continue now with immigration. So what some new video is showing regarding migrant children at the border.
Plus, there was a lot that was lost during our pandemic, but one that we overlooked was sleep. Why that has been incredibly taxing as we try to rebound. Stay with us.
Action News.
And welcome back tonight. Taking a look at some of the stories making headlines around the country.
Well, the Justice Department now has arrested and charged 2 men with assaulting U.S. Capitol Police Officer Brian Sicknick during the January 6th riot. A 32-year-old Julian Hayter of Pennsylvania and also 39-year-old George Tanios of West Virginia, they were arrested yesterday. The DOJ here releasing these images showing what they allege are the series of events leading up to and also after the deadly assault of Officer Sicknick. Well, both suspects right now, they're facing multiple charges, including assaulting a federal officer, but the charges do not include homicide.
The CDC may revise its recommendation to distance 6 feet in classrooms. A Harvard study published last week found no difference in COVID transmissions in Massachusetts schools when students distance 3 feet instead of the CDC recommended 6 feet. Students in that study were wearing masks, and the CDC isn't quite ready to revise its recommendations just yet, but its director says the agency is looking at the possibility.
Well, some new video here shows the growing surge of unaccompanied migrant children along the southern border. Now, inside these tents, hundreds of them crowded together without their parents. Now, that is according to lawyers who've gone now inside sharing what it is that they have seen. Well, they say that 45 to 50 children share rooms like this one that you're looking at right now. The White House says that it has a 5-step plan to address the problem, including returning facilities to full capacity based on new CDC guidelines.
And coming up on 13 Action News tonight, COVID-19 stress versus sleep. Why the pandemic has taken a toll on us trying to get enough Z's.
Plus, it is nighttime, so why there could be more fans at T-Mobile Arena for tonight's game against the Sharks. Dan.
The Desert Doppler is still quite active. Scattered showers and storms on this 13 first alert action day, and it's a Monday. My brain is fried. Also, a wind advisory still in effect. I'm tracking both the rain and the wind and letting you know when things calm down in just a few minutes.
Welcome back tonight. Over the next several months, we are helping you get back to business in our series called The Rebound Las Vegas. As we hopefully move closer to the end of this pandemic, it's time to restart a reassessment. Now, one thing you may realize is you're tired lately. A lot of us are. Stress takes a toll on your sleep. And in honor of National Sleep Awareness Week, we spoke with a local expert about getting a very good night's rest.
I would doze off during the day.
at work.
John Corder suffers from sleep apnea and says the stress of the pandemic makes for a 1-2 exhaustion punch.
It can play havoc with your sleep pattern.
To provide John with the quality sleep he needs, doctors prescribed a CPAP machine.
When I go to bed, I can sleep almost right away and then get up when it's time to get up. So I feel rested.
Plenty of people in the valley will tell you just the opposite.
Complaints of insomnia or sleep disturbances or not enough sleep has been something that's gotten worse over the course of the pandemic.
Dr. Tara Rachakonda with the Sleep Center of Nevada says a good night's rest is essential for our mental and physical health. While sleeping, the body grows muscle, repairs tissue,